California is currently experiencing massive forest fires in almost every county, the largest in recorded history in terms of acreage burned. The state has experienced blazes even before Europeans arrived, but not even close to this extent. So far, more than 70,000 homes have been evacuated in two counties alone, probably with more to come as most fires aren't fully contained yet. In a super hot summer, PG&E has been forced to shut off power in some areas to prevent sparks from igniting more blazes. What are the causes of this disaster? Forest management in California has brutally suppressed even the smallest inferno for over 80 years. This has led to excessive density of vegetation that was once removed by small occasional blazes. Because this no longer happens, naturally occurring fires now grow out of control because there's an abundance of fuel. Nevertheless, the problem is worsened by a changing climate due to human activity. Since the 1970s, our summers have warmed by 2.5 degrees, while our winters have followed a similar path. Extreme drought has also become more common. Because forest fires traditionally happen when it's warm and dry, this problem now has the perfect conditions to flourish. Forest fires have dramatically affected the health and well-being of California residents. Smoke from nasty fires spews millions of tons of toxic pollutants into the air. Individuals with pre-existing respiratory conditions like asthma now find breathing impossible in affected areas. Patients are developing unpleasant mental health conditions like post-traumatic stress syndrome. Those directly exposed to the flames are more likely to develop third and fourth degree burns. The first effect has resulted in victims paying for expensive hospital and doctor visits. The second has caused overcrowded psychiatric institutions, while the last consequence has directly resulted in severe overcrowding of emergency rooms.
Hi everyone, my name is Samantha Sosito. I'm an undergraduate pre-med student here at UCSD, and I'm accompanied here today by Dr. Anthony Magid.
Hi, my name is Anthony Magid. I'm a pediatric otolaryngologist, that's an ear, nose, and throat doctor in the Department of Surgery at UC San Diego and at Rady Children's Hospital. And in addition to being a pediatric ENT surgeon, I'm also the medical director of the Human Research Protections Program at UCSD and the chief of physician integration at Rady Children's Hospital, which involves overseeing the telemedicine program as well as reporting duties for research.
Thank you so much for being here, Dr. Magid. I only have a few questions for you today.
Sure.
So first, I'd like to ask, why do you think the UCSD School of Medicine hasn't done a great job in incorporating climate change into the curriculum, despite the overwhelming evidence of its effects on public health?
Yeah, well, I don't think it was an active move not to incorporate it. I think it's something that the medical school is aware of now and actively incorporating into the curriculum. I think the main reason which most medical schools face is that the amount of material that you have to present to medical students is overwhelming at times. So medical schools have actually been in the process of removing material that seems somewhat extraneous. So I think it wasn't necessarily an active avoidance of climate education, but I think it was trying to make room in a very busy curriculum for the medical students.
Right, that makes a lot of sense. Thank you. Now, what are the consequences for medical school graduates if anthropogenic climate change isn't discussed in the near future?
I think you can be potentially blindsided. I think you can go through many diseases that both children and adults face and attribute them to climate change, or at least exacerbating the conditions related to climate change. An example would be asthma. That could be adversely affected by the change in flora related to the changing climate, to weather, and specifically even infectious diseases, where I think there's very significant concern that there's going to be emergence of new infections that were kept down by areas that were traditionally very cold or were killed off during very cold winter seasons, that we may see either an emergence of old infections, we're talking about millions of years ago, as well as even current infections being more virulent and more dangerous potentially. So I think it's an awareness of how their practice is going to be altered and anticipating how their patients are going to present differently because of the potential for either emerging new diseases or exacerbation of currently treated diseases.
So how do you pursue climate justice? Simply talking about it as a separate field isn't sufficient. It has to be integrated into every imaginable field at or off colleges that educate. In the case of the UCSD School of Medicine, this simply involves making some basic alterations that don't involve changing the med school's curriculum. As you probably already know, in the Year 1 Foundations of Medicine class, which introduces cell biology, molecular biology, and genetics, a professor could weave in a discussion about how a key reason behind respiratory illnesses and resulting hospital visits associated with smoke is immune dysregulation. In the Year 2 Mind, Brain, and Behavior class, which has mental health as part of its curriculum, a possible discussion might be how extreme fear for the lives of loved ones during fires leads to PTSS and greater interaction with psychiatrists. In the Year 3 class, Surgery 401, one of the first practical trainings that med school students have, a professor could weave in the direct clinical experience that many burn patients from blazes wouldn't be interacting with you at your clerkship if anthropogenic climate change wasn't a problem. Our proposed reforms also extend to the esteemed clerkship, which should have some relation to anthropogenic climate change. There are many possibilities on how this can be accomplished while maintaining most of the existing guidelines. Perhaps students could directly assist burn victims of a major fire through normal procedures like helping medical providers clean the affected area. It also must be noted that students would learn about the relationship between human-caused global warming and the specific fire that caused the patient to go to the hospital. As you already know, the reason behind the independent study project is to give students some leeway in researching a topic they choose in depth. Although we love this, the basic requirements should extend to include something climate change related. For instance, a student who decides to study the health effects of forest fires on patients could choose a narrow specialty already covered in previous lessons. Perhaps they could investigate the exact methodology of how immune dysregulation comes about and its biological consequences on victims. That being said, the focus should remain on the human body, but maybe slightly incorporate how climate change increases smoke from fires and thus increases the prevalence of this nasty condition.
The best way for the UCSD School of Medicine to go about such reforms as to include climate change in its curriculum?
I think the approach that UCSD is actively taking in its nascent stages at other schools as well is really incorporating it almost as a thread into the core curriculum. So there are obviously various approaches. I think at one point there may be separate courses, electives per se, that are directly at climate education. But I think one of the most effective ways to present this information to medical students is actually to incorporate it into existing courses and identify where climate change interacts with the underlying pathophysiology and diseases that they're being taught, so that climate change has clinical relevance for the medical students.
Right. That's a very good point. So in going off of that, what do you think are the greatest obstacles in the way for this type of project to come about?
I think it's finding the time, but I think already we are seeing quite a bit of motivation on the part of the faculty, and the committees that are involved with developing curricula for the students include students as well. So there's been tremendous enthusiasm on the part of the faculty and the students for incorporating climate education in the curriculum. So I think that's probably one of the biggest hurdles, is to get people motivated. And now that they're motivated, they're going to actively look for ways to include that information into the lectures. Again, tremendous amount of burden placed on medical students right now in terms of the volume of material. But I think that this is an opportunity to build on what already is in courses in terms of material, and giving it a perspective related to climate change.
Earlier this year, UC San Francisco released the Bridges curriculum, which allows students to explore medicine and appreciate climate discovery. Students in the then pilot program participated in a 2-week inquiry course to explore how the 6 domains of science are related. One of the classes explained how human health is affected by anthropogenic climate change, plus explored how healthcare professionals helped cause the problem and could pursue climate justice through things like making health systems more sustainable. In addition, infectious disease professor Peter Chin Hong has integrated global warming into some of his classes by exploring the relationship between global warming and the spread of infectious diseases. Students at UCSF have been super receptive of these reforms so far. One went so far as to say, climate change is a medical issue, as we're already seeing the effects on all types of diseases. If you want to be on the front lines in changing the UC San Diego Med School curriculum, please join the Green New Deal at UCSD. We are an on-campus org that consists of anyone affiliated with UCSD. undergrads, graduate students, postdocs, staff, faculty, and alumni. We have 4 main goals to get UC San Diego to take real action on combating climate change: significantly reducing greenhouse gas emissions by 2025, teaching climate justice to all undergraduate and graduate students, getting rid of all endowments and pensions in fossil fuel companies, and expanding our movement to other UC schools. We have already achieved a lot, such as integrating the climate crisis into history professor Carl Gerth's class, starting in 2021. So what does this mean for you? Well, you can be on the front lines of not only changing standards that affect you, but also ensuring that your UC sister schools follow our path. If you want to become a member of or follow our awesome organization, please take note of the information on this slide. Here are some more resources if you'd like to learn more about what we covered today.